appreciate everybody that showed up this evening. Um, I am somewhat new here to Gilead. I see some familiar faces here. But I was hoping to do lectures maybe about once a month or once every other month on just general health topics. Not so much to kind of endorse any programs or anything else like that, but more importantly, just kind of education to the public about certain conditions or certain subjects. So if anybody ever has anything that they want to hear about, I'm open to suggestions. Obviously, today I'm a little biased in that I'm going to talk about something that I like, but also something that a lot of people ask questions about. So I did my first lecture probably about 2 months ago, just an introductory lecture. And I got a lot of questions about regenerative medicine. It is one of those things where people don't really know what it means, right? Regenerative medicine, what is that? And a lot of physicians don't know what it means either. I want to say a relatively new field of medicine that's still evolving, but it's pretty exciting stuff. So I think. I'm going to do that cliche thing, and I'm going to get some audience participation. Who here has joint pain or knows somebody that has joint pain? Oh, then this lecture is for you. That's what I'm supposed to say. No, I'm not going to do that. But no, it is something that's relevant, and I feel like a lot of people benefit from, even if you don't perhaps qualify for regenerative medicine procedures, or that's not the right route for you. Whenever it comes to making a fully informed decision about your healthcare, it's good to know what all your options are. And unfortunately, like I said, a lot of people don't know what exactly regenerative medicine entails. So it's just kind of nice to just add one other thing as far as possibilities when you're dealing with joint pain. To put it most simply, when we say regenerative medicine, we're talking about different techniques or different procedures that are non-surgical, meaning, there's no scalpel, it's not in a surgical suite, there's no anesthesia, nobody has to drive you home. It uses the body's innate ability to heal itself. There's a natural healing cascade and healing response that the body has, and it tries to heal things, and we can use that to our advantage by activating it in order to get some repair for certain conditions. And then I think one of the biggest points that I like to drive home with patients is that it's not a band-aid, because patients will ask, is this the sort of thing where it's going to wear off in a couple months? And my answer is, I hope not. It should be addressing the underlying issue, which when it comes to musculoskeletal conditions like say arthritis or torn rotator cuff, things of that nature, most of the options available out there are not curative or are not treating the underlying issue, right? Any of you that have been to the doctor with a problem like this, what do you get, right? Rice. It's rest, ice. What does C stand for? Copay? Copay. Right, and then maybe physical therapy and some painkillers to numb the pain, and then finally, when it gets bad enough, you get an X-ray, because you need an X-ray before you can get an MRI, and then you go and you see the doctor, or the orthopod, and maybe you're a candidate for a joint replacement, which sometimes we need joint replacements. I'm glad that we do have good surgeons, but it's also nice to try and prevent that or postpone that if we can. So why do I love regenerative medicine so much, or why am I interested in it? And I'm going to tell you my own story. So I was first introduced to regenerative medicine when I was a young man. No, I wasn't a young man. I was a teenager, not even a man yet. I was probably about 13, 14 years old, back when dinosaurs roamed the earth. And I had a bad accident, injury, and I tore my left ACL, like almost completely. I was on crutches, swelled up, couldn't get around, was not functional at all. And now that I'm a physician, looking back in retrospect, I realized that had my patients taken me to the regular doctor, I probably would have gotten an MRI and I would have had my first surgery when I was 13. But instead, I ended up actually getting prolotherapy to the knee. And I had a few rounds of that spaced over a few weeks apart, maybe 6 rounds or so. And fortunately, I was young, and younger people heal way quicker. And I had complete resolution of my issues. And to this day, out of all the problems I have, this left knee is not one of them. So it wasn't one of those things where I said, man, I'm going to go to medical school and I'm going to do regenerative medicine. It just kind of sat in the back of my mind. So finally, when I went to medical school and decided to go into family practice, it kind of resurfaced. I said, this is a really cool thing that should be implemented along with family practice to kind of help patients along. I went to medical school at MSU's College of Osteopathic Medicine. And actually, even before I started my residency, I started getting training in regenerative medicine. So, any weekends, vacations, even moonlighting, which is working. You can work outside of residency, like after you finish your shift, you can go work for somebody else. I was taking advantage of all that, flying out to Texas or to where else did I go? Arizona. Went to Arizona, right, Emily? Florida. Went to as many clinics as I could, anybody that would take me, as well as other medical conferences, to get more training in this sort of thing. So I was able to get like my initial certification in 2018, and then after I had enough years of experience as well as also enough patient cases that I could document, I was able to get board certified in this. And I actually got my board certification in regenerative medicine before I got my board certification in family practice, because I kind of cared more about this than the other one. Not that family practice isn't important. So for the past 2 years, I have been practicing out in Mason. I am a private practice, so I'm not affiliated with a hospital like Sparrow or McLaren. And just recently, I came here to Gilead for part of the week, which is obviously why I'm here talking today. So, I keep saying that regenerative medicine is this relatively new field of medicine. And to a certain extent, that's true as far as the name and people's familiarity. But historically, it goes all the way back to. I'm not really good with history, but the Romans, like maybe first, second century AD, where these soldiers, they would have their shoulders dislocated. And if anybody here has ever dislocated something, it is never the same afterwards. Specifically, it's loose. It goes out of the socket sometimes. And as a soldier, you can't really hold a sword if your arm isn't in the socket. So what they figured out, which is very crude and barbaric, but it kind of worked, is that if they took a red hot poker, a very thin one, and basically jabbed it into the shoulder along where the rotator cuff attaches, that basically it would cause some scarring, and that scarring would help stabilize the shoulder so it wouldn't go out of the socket as much. So I currently do not offer that procedure, but we've come a long way since then, and it was probably in the mid 1900s, so like 1940, 1950. We had some guys like Gedney and Hackett. If you ever look up prolotherapy, you'll hear about Dr. Hackett, and these are guys that kind of furthered or kind of really established the field of regenerative medicine by figuring out what solutions could be used for prolotherapy, which is kind of all we had before, as well as also then doing the research on it, taking rabbits and actually breaking their ACLs and then injecting it, and then putting them down and taking that tissue, putting it under a microscope and actually seeing what happens. I don't think PETA would allow anything like that anymore. But we learned a lot from those studies and we figured out a lot. And it kind of grew from there slowly. Most recently, in say like the 1990s or 2000s, it became more more popular in the sense that, if you lived in a given state, you could probably find somebody if you looked hard enough that's within a couple hours of you that does prolotherapy or some sort of regenerative medicine. But around that time, which is nice, we also started to develop other modalities or other tools to put in our toolbox. So it wasn't just this technique called prolotherapy, and it's really gained popularity since then with professional athletes, Tiger Woods, some of these professional fighters, things like that, Joe Rogan, those sort of guys. That's how more people are hearing about it now. So I keep saying regenerative medicine. It's not one. It's not just one thing. It's a whole bunch of different things that kind of fall under that umbrella term, and the ones that I listed here are just some of the most common. By all means, I'm sure there's other ones, or I know there's other ones. But prolotherapy, platelet-rich plasma, or PRP. Some people do ozone. Stem cells and exosomes kind of go together. I currently do not do those, and there's kind of some FDA regulation stuff with it. I do think stem cells will be the future of medicine at some point in time, but I don't think we're 100% there yet. So, me personally, I don't want to be the guinea pig on that one. And then shockwave therapy, or ESWT, just to name a few. So, what can it treat? Obviously, we're talking about joint pain, right? That's how I started this whole thing off. But pretty much anything that deals with the joint, whether it be ligaments, tendons, cartilage, a torn rotator cuff, a torn labrum, arthritis, TMJ, plantar fasciitis, you name it, and it has been used and studied in that manner. Um, I'm not saying it can like completely fix all these things and make you guys 20 years old again, but these are all things that have been studied and it's used for. But rather than standing up here and telling you guys that there's this really cool new field of medicine that you've never heard about, and it's gonna, fix all of you, I kind of like talking about the science behind it a little bit. Kind of helps understand, what to expect if you were to look into this, and kind of how it all works. And I heard a really good quote, which I think kind of sums up the best way to approach the science, and that is, it is science. You're not supposed to understand it. I First time I heard this, I thought it was hilarious. Obviously, a little bit of satire, a little bit of social commentary, but that's how things can be in medicine a lot of times. There's this treatment, and I'm not going to fully explain it or go through any of the science behind it, but just understand it's a good thing and you should do it. I don't really want to do that with my patients, because otherwise, how could they make an informed decision? But I'm going to do my best to explain it without using too much jargon. So, just simply put, regenerative medicine, for the most part, works by stimulating the body's healing cascade, which is innate to the body, in that it does automatically when, say, you roll your ankle for the first time. It goes through a healing cascade, and it starts with the inflammatory cascade. So the trick is if we can re-stimulate that healing cycle and kind of help it along the way as well. Also targeting too. So yeah, controlled inflammation in a localized area. This is a really boring graph that every single medical physician had to learn in med school. But what it shows, for the most part, is that when we talk about the healing cascade or what the body does, it goes in stages. The first step is inflammation. It picks up within about a day or so. It dies off within 3 to 5 days. After that inflammation happens, then we start to go into the proliferative phase where we actually start laying down connective tissue. That falls off by anywhere from week 4 to 8. And then we start the maturation process, which is, hey, we built a bunch of stuff, let's start trimming it up and reinforcing it and making it functional. So The first step is that inflammatory cascade, and this is you twist your ankle and it gets hot and angry and red and painful. And what's happening is there's vasodilation, which is the blood vessels open up wider and become a little leaky, for lack of better terms. And that's so the body can deliver more oxygen, more nutrients, more of the cells that are needed there, and then those cells can also go out of the blood vessel and go to the tissues that need healing. Um, at the same time, there is cytokines and growth factors. Cytokines, that's a fancy term for something that tells the body or something that tells the other cells something's going on here, come over here. It's like an invitation to other cells. That's what cytokines are. And then growth factors, which are self-explanatory, right? They stimulate growth. And that's obviously the inflammatory cascade is the part where you get the pain from the prostaglandins and whatnot. So after that starts to die down, if you remember that graph, then we go into a proliferative phase. That's actually where we start depositing collagen. So collagen is the fundamental structural element of most connective tissue in the body. So what happens is we have angiogenesis, which is a fancy term for basically the formation of new blood vessels, which is actually pretty cool. Because the name of the game when it comes to repairing joints, and one of the reasons why joints don't heal the same as, say, if you get a cut on your hand, is because there's limited blood flow to these areas. So actually building new blood vessels is a pretty cool thing to be able to take advantage of. At the same time, there's fibroblasts that, like I said, are laying down collagen. And then from there, basically, we go to the maturation phase. So around week, I say 6 to 8, that's where we reach our peak of collagen deposition. So that starts to fall off at that point. So the body says, okay, we laid down a bunch of connective tissue, and it's kind of a modge podge. If you could imagine a bunch of fibers, it's kind of all, disoriented like this. It's just enough to kind of keep you safe. For example, if you were to cut your hand, it's enough to cause a clot and keep the skin integrity up. But it's not the same as what you had prior. So this is the part where the body starts trimming things up. It starts making linear fibers and starts cross-linking them. So that way there's some real structural integrity and flexibility to the area in really trying to restore it back to the way that it should be. This is one of those things where if we're going through the healing cascade, you roll your ankle, right? You go through this whole process, and then it gets a little better, right? But then later on, you might have problems with it. So I am glad I got through that part. That was the worst part of the lecture. I felt like it was a lot of talking. There is no test or quiz. So you can kind of forget all of that. And really, all that you need to know is the basics of it, which is that, we're talking about well established healing mechanisms that are pretty much irrefutable. Nobody can argue how the body heals in these stages that we're talking about. We're also talking about utilizing this healing cascade and starting with the inflammatory response. And then finally, the fact that when the body tries to heal itself, when it comes to joints, it typically does so incompletely. So I keep using the example of rolling your ankle. I see it plenty of times. You play soccer in high school, you roll your ankle, you step in a hole, you roll it again, it gets better, you don't even notice it, and then one day you hit 30 and it rears its ugly head again. So I have this quote, which is the body never forgets an injury, because most of the time it'll show up again. Sometimes it does pretty good, but when I see patients and say I take a look at their wrist or their ankle, and I start manipulating it, I'll say, when did you fall on this wrist? When did you twist this ankle? And they'll say, nothing happened. Like, right? I mean, nothing I can think of. And I said, no, not like within the past month or 6 months. I mean, when you were younger, right? Like, did you have an injury, a car accident, something? The body compensated for it up until a point where finally it started presenting with symptoms. or at least more noticeable symptoms to the point where they wanted to see a physician. So just to get right into it, talking about some of the different techniques or different treatments that are available with regenerative medicine. Prolotherapy, I've mentioned a couple times now because that was the bread and butter of regenerative medicine for decades. It is a relatively benign concoction. If I were to explain it, it's nothing more than dextrose, which is corn sugar, lidocaine, which is the numbing medication you would get at the dentist's office, and then normal saline, which is what you would get at the hospital if you're dehydrated. The trick to this is that the dextrose or the corn sugar, at a certain percentage, it is what we call hypertonic or just slightly irritating to the surrounding tissues. So it's injected to the point of interest. So, for example, if I had a torn rotator cuff, there'd be a couple of pokes to the area where I wanted to go to. And that would cause controlled localized inflammation, which is what we want to stimulate the healing cascade. So you would actually have increased pain the day you left the office. That would go back to baseline in about 3 to 5 days. And then later on, you don't really expect improvement until usually I say 6 weeks out. It could take longer than that, but typically it's injections every 2 weeks. I usually do 3 rounds spaced 2 weeks apart. Maybe give the body 4 weeks and then reevaluate, see if you're responding or not. But one of the newer modalities that we have now is platelet-rich plasma, or PRP. And this is similar to prolotherapy in that it stimulates the body's inflammatory cascade. But the really cool thing about this is that it actually has concentrated growth factors in it. So it comes from your own body. It doesn't come from a pharmaceutical company or anywhere else. And those growth factors from your own blood can be concentrated. They can be injected back into a point of interest or a point of injury, stimulates the healing cascade, but then also gives a big bolus of those growth factors right where they need to go. And the research on this is a lot more impressive than the prolotherapy, even though it's newer. So you would think, well, heck, we have decades and decades of prolotherapy research. But the PRP, both in the literature as well as anecdotally, meaning the patients that I've seen and I've treated, it seems superior in some cases. When I first started, I did what the ancients before me did, which was let's just do a bunch of prolotherapy. And then after a certain number of rounds, I would reevaluate. And if a patient wasn't getting the response I thought they should, then I would say, okay, well, now let's do PRP. Well, maybe we should just start with PRP, right? As opposed to wasting people's time and whatnot. But there are certain situations where prolotherapy can be better right off the bat. So how that procedure is done, it's in the office. Again, no surgical suite. The whole procedure takes about an hour. Blood is drawn from the upper extremity, similar to like if you were to get your labs done. And then it's spun down in a centrifuge in the lab. And then it is separated. As you can see that vial there, the blood separates based on the gravity of its different components. So once we separate that, then we can pull off that middle layer, which is platelets, which have concentrated growth factors in them. And then the last modality I'll talk about is shockwave therapy. And this is one that is also, well, I think they're all pretty cool. I think I keep saying that. But this is one that actually has FDA approval, which for this sort of type of medicine, field of medicine, that's kind of rare, right? Usually everything is off label, FDA doesn't want anything to do with it. But shockwave therapy is it's a shockwave. It's a pressure wave moving faster than the speed of sound. It travels through the skin without any needles. It hits a point of interest, and it can do all the things that we were just talking about to a certain extent, as far as stimulating the healing cascade, down regulating some of the negative inflammation that can come along with certain conditions. But the thing that I really like about this modality is when they first were getting their FDA approval and they were doing their research in the early 2000s, they looked at plantar fasciitis, right? And sometimes people say, "Oh, I have a heel spur," right? Well, the heel spur isn't your problem. It's the plantar fascia that attaches to your foot bone, which then results in this little bony growth on your foot. So they used it for plantar fasciitis, and they found that it actually works better than the steroid injections with less complications. But then they had this incidental finding that the bone spurs actually decreased in size. So this is something kind of different than the other modalities in that it can actually help with some of these calcium deposits or bony growths, things of that nature. Um, but I find it most impressive being used synergistically. So, meaning using it alongside other injection techniques. But I will use this as solo therapy in certain cases. It just it depends, right? I mean, at the end of the day, you should be seeing a physician who isn't going to do a cookie cutter algorithmic approach. It needs to be customized to your situation and what's going on with you, as well as what you're willing to put up with. So some people don't like needles. I'm that way. I have no problem poking people, but I do not like being on the receiving end. I hate that. So I was gonna do like myths and facts or something like that. I don't know. I asked ChatGPT, like, do you have any recommendations on like what might be a good idea stuff to talk about? And for whatever reason, I was like, yeah, that's a good idea. And then I was practicing this presentation. I said, this is silly. So I left it in there. Pretty much when it comes to myths and facts, I think the biggest misconceptions that go along with regenerative medicine would be number one, it's not covered by insurance. So why isn't it covered by insurance? Is it just like a bunch of bull? Well, no, it's not. There's a lot of research behind it. Obviously, there still needs to be more research in certain respects because there isn't. I don't want to say there isn't standardization, but you can go to different doctors in this city and they'll do things differently. So I do think there needs to be a little bit more standardization, and that's one of the reasons why I like talking about regenerative medicine and being involved with it because I hope that the field is able to move forward to the point where insurance will pay for it. The only insurances right now that pay for it would be the Christian insurances like Samaritan. Never had a problem with Samaritan, and then sometimes Workman's Comp. But otherwise, health savings and things like that, it qualifies for. But just because insurance doesn't pay for it doesn't mean that it doesn't work or it can't work for you or it can't help you. Other than that, I think the other misconception is that these sort of treatments just build scar tissue, right? Like the ancient Romans, and that's not true, right? They sacrificed a lot of poor bunnies to prove that that was not the case. It's actually building functional connective tissue, or at least it can, or it should, if done on the right patient for the right condition. With that being said, actually, does anybody else have any myths or facts, like anything they've heard of? Like, hey, I heard that PRP does such and such, or anything like that. No, say yeah. See, I didn't need a slide. So I'm not up here to tell you that I have the fountain of youth and this is a silver bullet. There's obviously limitations, and sometimes patients don't respond as well as we hope they would. So it's always about making sure there's a good medical evaluation, and then you yourself also keeping in mind some of these factors that go into how well you can heal. The first one is if you have a tear in a tendon or a ligament. We kind of need to know, is it a complete tear or is it just kind of like some fraying? So I like to think about it like a rope, right? Is your rope a little bit frayed or did that rope get cut and it's completely separated? I can't bring two ends of a rope back together. And I've had patients come into the office, complete tear, completely separated. And within 5 minutes, I say, end of appointment. You don't owe me anything. You need to go see a surgeon. I can't do anything for you. So just realizing that this cannot treat complete tears. The other limitation, it would be, and I hesitate to say arthritis, but when somebody is bone on bone, we're kind of working an uphill battle, and there needs to be a heart-to-heart discussion about what is a realistic expectation of using these treatments. Like I said, it can't give you the knee of a 20-year-old again. It's not going to give you back that joint space, but it can protect the cartilage. It can restore the cartilage to a certain extent. It's a little harder with cartilage than it is other things. But I think one part that a lot of physicians don't think about is when you have arthritis, you need to be looking at the stability of the joint. You can imagine a knee joint, right? You have arthritis in it, but what if your ligaments are loose? So every time you're moving that knee, rather than moving in a nice hinged manner like God intended it to, it's shimming and moving and it's grinding away at that cartilage. So just increasing stability can help a lot with these sort of things. But at the same time, when there's bone on bone, I usually want my patients to at least consider talking to a surgeon, not saying, hey, go have the surgery, but at least have all your options on the table. And then if you really want to try this, maybe we can improve your quality of life, postpone, avoid a surgery if we can. If you have a fake joint, I cannot regrow that. If you have a titanium joint, this does not work on titanium. So I've also had that come up. Otherwise, nerve root compression, people with bad backs, and there's nerve pain going down their leg because that nerve is getting pinched where it leaves the spinal canal. I cannot unpinch that nerve. I can stabilize the back. I can do other things. I can potentially stabilize it to help, a disc kind of resolve on its own. But if you have bony growth and it's just pinching right on that nerve, I can't get rid of that pain for you, unfortunately. And then other limitations are just general health limitations in terms of metabolism, healing, functioning. People with untreated or undertreated hypothyroidism are not going to heal or even function as well. Hormone imbalances. I've seen a lot of guys with low testosterone, which men's health is another passion of mine. And we know from the research that men with optimal levels of testosterone, they just heal better and faster. On top of that, obviously, if you smoke, you drink, you take a lot of ibuprofen, all of that is going to inhibit any sort of response. And then chronic health conditions is a given. And then nutrition, right? So somebody said that food can be medicine. Is that Dr. Jangi? No, it was me. I hope he's watching this. It was me. I said that. No, so I mean, food can be medicine, right? I mean, it matters what you're putting into your body. Obviously, some of my patients do anti-inflammatory diets, that sort of thing. Also, making sure that you're getting enough vitamin C. Vitamin C is necessary for the cross-linking of collagen that we're trying to build, so that's really important. But it's just really giving your body all the building blocks and everything it needs to do what it was meant to do, and what we're trying to get it to do. Now, the absolute contraindications, not like the sort of, maybe you should think about this or realize that it'll affect your healing, but autoimmunities. Like if you have rheumatoid arthritis or psoriatic arthritis, the issue with those conditions is too much inflammation, right? That causes damage. With these treatments, we're trying to create a certain amount of inflammation, controlled inflammation, but too much and it damages joints. So the last thing in the world we need to do is induce more inflammation. The only exception to this is shockwave therapy. Studies have shown that it seems to be fine in people with rheumatoid arthritis, but still, I don't think I'm treating a lot of RA patients with shockwave. Obviously, if you have an infection, and I know some of this stuff sounds silly, but I've had patients come in with a bad cellulitis or maybe like a raging pneumonia. Obviously, make sure your body is where it needs to be before considering this treatment. Otherwise, all its energy and everything else is going to be going towards fighting that infection, dealing with that, not trying to heal your bad knee. The other one would be steroid use, whether you take a steroid daily, like a pill. I'm not talking about Flonase or anything like that, or a steroid inhaler for COPD, but people that take steroids as a pill daily, obviously it's not going to work because steroids prevent your body's response. And then also, if you've had a steroid injection within the past 4 to 6 weeks, your body's just not going to respond. And then obviously, if you're allergic to anything, The only thing that comes up sometimes is dextrose. I have some patients that have a corn allergy, so obviously I'm not going to use dextrose because that's corn sugar. But then there's right, we just document that and we can use something else. But I was. Let's see, what time is it? 36. I really didn't want to go too long. No, I want to leave it open for questions. One case study. Okay, sure. All right, so this is probably my favorite case. Great patient. So a 30-some-year-old osteopathic physician had a fall down a flight of stairs because his brother-in-law didn't come over to help him move something like he promised he would, and he ended up dislocating his shoulder, fracturing it, and then also shattering his knee. So he went to go see a surgeon, which was a good idea. He's not crazy. He doesn't want to just let this go to chance. And he met with this surgeon, and the surgeon said, I can do surgery on this, but it might cause more harm than good. So, do you want to schedule this? No, of course I don't want to schedule it. I ended. Obviously, this is me. If anybody didn't catch on to that yet. Anyways, I ended up having PRP as well as exosomes, and I've been blessed enough where I've been able to avoid surgery. I'm able to play with my kids. I'm able to throw bales of hay, work outside all day digging holes, and I've been fortunate, right? And I always tell people that I drink my own Kool-Aid, right? Like I don't do these. I don't offer treatments that I wouldn't do myself. And that's not to oversell it again, right? I was blessed in the fact that I had a pretty bad injury, and then I responded as well as I did, or completely. So, um, otherwise, I think another good one would be, um, just talking about goals. So there was a 40-some-year-old female horse enthusiast. Um, what's that horse town around here? Metamora. People love Metamora. Metamora is a big horse place, right? Anyways, so people out in Metamora, they all ride horses. That's like their life. And this individual had really bad hip pain, and we ended up doing PRP. She responded pretty well. I mean, 75% improvement. Which, if you think about the other options available to that woman, something that's non-surgical giving you 75% improvement, I mean, that's remarkable. That's amazing, right? But the problem is when you have a goal, which we always set, if you're still 25% away from your goal and her goal is riding a horse, then it's still not good enough, right? 75% improvement is great, but if she can't ride a horse, then it's a problem. So we talked about, what are we missing? Is there anything else we can add in? That's why it's always important to reevaluate or have a physician who's reevaluating, as opposed to just saying, we're going to do 100 rounds of this, and then, once you run out of money, then we'll see what to do. And we went back to the drawing board, and we started talking about shockwave therapy. And actually, she brought it up because her horses were getting shockwave therapy from the vet, and the vet charged more than I did, which is crazy. Anyways, so we ended up doing shockwave therapy on the hip just prior to then doing some prolotherapy, and it was like just right off the bat, like all of a sudden she started moving again. She had this improvement. She hit a plateau, and then the shockwave therapy kind of bumped things along and got us improving again. And within probably 6-8 weeks, she was riding horses again. So she was obviously ecstatic about that, and a really great case. But just kind of illustrating that, setting a realistic goal, realizing that you can hit plateaus with these sorts of treatments, having realistic expectations, and then also making sure that you're always reevaluating, making sure that nothing is being missed, as far as if you're not getting where you need to be. So that's pretty much it. So uh, she's a paid promotion. She's my employee. We should have a caption up there. Yeah. Anyways, at the end of the day, I just kind of wanted to like give some information about what regenerative medicine is. If anybody has any questions, you can ask them publicly as far as if you want to do that. Otherwise, I'm going to hang out for a little bit if anybody wants to talk to me about anything they have going on. There's some information on the website. Otherwise, I'm sure everybody has Google now. There's tons of information out there, but it can be tough, right? I mean, you start Googling stuff and you get a bunch of advertisements for QC Kinetics or something else. I guess my advice would be wherever you go to seek regenerative medicine procedures, just make sure that they're a moderate on the situation, because I don't think there's enough of us moderates, right? Being realistic as far as what to expect, not trying to sell you a silver bullet, but really trying to work with you in order to produce a realistic result. So, any questions? No? Okay. All right, we're done.